Hello everyone, let's talk about CSF analysis. To analyze the CSF, first we want to take out the CSF. How do we take out? With the help of the lumbar puncture. So how do we do the lumbar puncture? For lumbar puncture, we'll puncture between L4 and N5 vertebra and we'll extract the CSF fluid. After extraction, what we'll do? After extraction the CSF fluid, we will analyze it in the laboratory. But there are some contraindications for lumbar puncture. What are the contraindications for lumbar puncture? So you can remember by the trick, police fails. P fails because suppose we are the police and we are trying to find out the thieves. Okay, we are trying to catch off the thieves, but we are not able to catch because we are not able to do the lumbar puncture and we are not able to get the organism. Okay, so for police fails, P stands for papilledema. Papilledema is seen when the intracranial pressure is raised. So when intracranial pressure is raised, papilledema is seen. We cannot perform the lumbar puncture. The another trick is fail. F is the focal neurological deficit. If there is any focal neurological deficit, for example, any right hand hemiparesis, left hand hemiparesis, any focal deficit is there, then we cannot perform the lumbar puncture. And there is altered mental status. And there's an altered mental status to think about the encephalitis. So when encephalitis is there, you cannot perform the lumbar puncture. Then immunocompromised state. I stands for immunocompromised state, in which if the patient is having HIV or something, there can be presence of brain occupying lesion. So we cannot directly perform lumbar puncture. Before that, we need to do the CT. Okay. So these are the conditions in which first we need to do CT or some imaging, then we can go for lumbar puncture. Then the L stands for any known lesion. Any known lesion, for example, tumor. L stands for lesion. Okay. Then S stands for seizures. S stands for seizures. If the patient gets any seizure at the time, we cannot do because the procedure becomes risky at that time. So this is the short mnemonic to remember what are the contraindications of lumbar puncture. So that is police fails, P fails because we are not able to identify the organism. So we fail to identify the organism or to identify the what was the reason for which we are doing the lumbar puncture. Okay, so this is the mnemonic. I hope you have got something from this video. If so, please like, share and subscribe.